The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Backache is one of the commonest causes of absenteeism from work. Let's study about that at this time.
Welcome to Help Yourself to Health with Dr. Agatha Thrash of Uchee Pines Institute. And now, here's your host, Dr. Thrash.
Hardly anyone goes through life without having a backache at some time. We enjoy a nice back rub, or a good neck rub, or a foot rub, all because of pains that we have in these various areas. Sometimes we may wonder, what is the cause of my backache? Is it caused by joints? Is it caused by discs? Or by muscles? Or by tendons? Well, let's study a bit and see if we can determine some of the reasons why people have backaches. And I'd like you to take a look at this skeleton that can help us to study backaches a bit. And you will notice that one of the important things that you see is the spine. The spine is this long structure here, and if you will look carefully, you can see that between two vertebral bodies, you will see a disc. You can see it also up here in the neck. Here is the vertebral body. Here is the disc, the area in between. This disc is comprised of fibrous tissue and blood vessels and a form of cartilage that we find principally in this disc and nowhere else in the body. Now, the bone can be a source of pain, or the disc itself can be a source of pain. Now, you will see in the back of the skeleton, here you can see that the skeleton also has what we call spines. Here are the spines. If the vertebral body is involved, pressure on the spine can help you to tell that it is the vertebral body involved in the disorder. We also have lots of muscles that go down the back. We have tendons that go up and down the back. We also have muscles that surround the shoulder blades and that we can feel only if we put the arm backward like this so that it makes the shoulder blade come forward. Then you can just put your finger under the shoulder blade and feel muscles under there. And a lot of times you can put your finger under the shoulder blade and feel a tightened muscle, a little segment of the muscle that has gotten very tight, or along the paraspinous muscles, you can feel those as well. You can see that the problem that the person has is with a little segment of the muscle that has become tightened, actually spastic, and then in order to release this, you need to either stretch it or press on it. And some pressure on that tightened muscle can be that thing that will enable the muscle to relax and give pain relief. Now, we've mentioned three things. We've mentioned the disc, we've mentioned the vertebral body itself, and we've mentioned muscles. But another very important part of the structure of the back and of that structure that keeps the back healthy is the blood vessel system. Muscles, if they are used nicely and kept strong and firm, the muscles encourage circulation. And I'd like to show you some of the structure of the back circulation. You can see here the tiniest parts of the blood vessels in the spine. These capillaries must feed not only the muscles and tendons and nerves and blood vessels themselves, but they must serve to nourish the discs and the actual bone material, the bone tissue itself. You can easily understand the fact that if a person has a reduced blood supply, either from lack of proper exercise or from hardening of the arteries, that the blood supply to the back, to the discs, to the muscles themselves, to the bones, that this will be cut down and will make the health of the back much less than it could be. So, as to what one can do about the problem that one has with backache, one needs to recognize some of the causes. And there are some non-serious backaches and some very serious ones. So for you to know the difference between a serious and a non-serious backache, here are some qualities of those things that go before the backache that can help you to know whether it is serious or non-serious. And number one, has there been any trauma that preceded the onset of the backache? And that can also be external force, or it can be some kind of movement that resulted in pain. Then, if it weren't for that particular type of pain that you have in your back, would you feel good? In other words, is your general health good, or is it associated with other symptoms in the body, such as fatigue, aches in the abdomen or in the head or elsewhere? If so, it is more likely to be serious than if it is simply an isolated backache. Are there certain postures that cause you to have a problem? If you lie down or if you stand fully erect, does that give you some relief? If so, it is more likely to be a non-serious backache. Movement of the back, particularly bending the back, does that make the symptoms worse? If so, you may have a more serious backache. Does rolling over in bed cause pain? You're not awakened by the pain unless you move, and then if you roll over, then it causes pain. If the pain doesn't cause you to move or to pace or to fidget or to writhe, then it's likely to be a non-serious backache. Have you had no change in your bowel function or bladder function? That can be another sign of a non-serious backache. If you have changes in these areas, then you may have some deep-seated problem in some system of the body that refers to the back, and that may be more serious for you. Now, about 61% of backache sufferers do their own treatments. That means that people who have backache need to be taught what the best kinds of back treatments can be. And for very safe treatment methods, you can read some books on self-help, but some of the important ones and some of the more simple ones, number one is that of exercise. Exercise should be geared to your own capabilities of exercise, and the first 2 weeks should be strengthening and stretching the muscles. Research has shown that strengthening the lower back muscles can help to relieve back pain. And so anything that will increase the strength of your back requires very little effort on your part, but it does pay great dividends in improving the pain in your back. Even a single session of muscle building exercises per week can be helpful. And it's not just back strength that counts, but abdominal strength and leg and arm strength as well. Any exercise that will increase the strength of the body anywhere can be helpful in getting rid of backaches. And one nice exercise is that of walking. It is not only strengthening to the back, but it is also quite pleasant. Unfortunately, a lot of people who go for a walk have a tendency to hold the head forward. And so we can see that the neutral position of the neck is with the head balanced right over the neck. But if the head is pushed forward, then a strain is put on the muscles of the neck, and that can cause pain after a while. If the head is tilted backward, that causes a strain on the neck muscles, and that too can cause pain. Now with a very simple experiment, you can easily see that putting the head forward causes a strain on the back. If you have something heavy like, let us say, an umbrella, if you hold it like this, it appears to you to weigh only a few ounces. But if you simply tilt it over in this direction, then the umbrella seems as if it weighs many pounds when it may just weigh a few ounces. Since the head itself weighs more than just a few ounces, to hold the head forward puts quite a strain on these back muscles, and simply correcting your posture while you walk may help to correct upper back pain and neck pain. Now, after the exercises begin of strengthening and stretching, step 2 is a concentration on the fitness that one can get. That's heart fitness and digestive fitness, so it involves the entire lifestyle. Everything about the way that the person lives should be examined, and everything corrected that can be corrected. The fitness program should last about 4 weeks, the stretching having lasted about, and the strengthening having lasted about 2 weeks, that initial strengthening. Now the fitness part can involve various devices. A stationary bicycle if you don't have a good place to walk out of doors, or to cycle out of doors. Cycling I like very much because, especially for adults, because adults can pedal along fast, and then if they get tired they can coast a while. And small hills are very helpful for the person who is trying to build up physical fitness. Another very good one, especially for people who have any kind of skeletal problem, is that of swimming. Swimming, with its weightlessness or near weightlessness in the water, makes it so that joints and muscles don't have to do weight bearing, and that of course improves the muscle activity, so that one can, without actual pressure on joints or pressure on tendons, one can get quite a lot of good exercise and good fitness for muscles without incurring any additional strain on the muscle. Now, as to how much you should exercise and when you can recognize that you're in a tip-top physical condition, and when you have pressed an exercise as far as you need to before advancing farther with the exercise, is a very simple test. If you can do that exercise while you're still speaking, then it's a very likely thing that you have already reached a plateau with your heart rate and the cardiac conditioning that you can get from that. Then step 3, which can last as long as one needs, is the developing of a proper technique with one's exercising. In swimming, there are certain types of strokes in swimming that result in strain on muscles or on twisting the back or various joints in a strained way, so that very simple paddling, such as dog paddling or the side stroke, can be very helpful in swimming. With cycling, one needs to have the seat level at a proper level, the handlebars at a proper level, and those that are high, rather than causing the person to lean forward too much, can be better for one than those that are made for racing. If you can't lean your weight on the handlebars, then the handlebars are probably not correct for you. Then the pedal length should be correct for your body. The foot should almost be straight with the leg and the thigh when you're fully in the down position with the pedal. So if you work on these techniques, this can help you to get good strength in your muscles without making a special strain on the back. And a few tips. If you have a back problem, start walking on the level. Don't start on hills. And with the cycle, with a bicycle or any other kind of cycle equipment that you use, if you're on a road, if there is a bumping of the head because of you're leaning on the handlebars, that may not be good for your head. Then another thing that you need to recognize is that the person who is walking or jogging needs well padded shoes, such as these Nike Airs. The good thick padding. So as you can see, the heel itself is quite thick, and this is spongy. And then on the inside, the sole is also spongy. If the sole is quite thick, that helps a lot, and it prevents the person from getting plantar fasciitis. Will sometimes prevent that. And so a very good shoe is mandatory for the person who is going to be doing a lot of walking and trying to build up the back muscles and leg muscles and the physical conditioning with this exercise. Now, if you're doing an exercise and your back acts up, stop immediately. Don't continue any kind of exercise that causes pain in your back. And once you get a pain, then if it is an acute pain, for the first 24 hours, you should use ice. And the way to do that is to take a block of ice, and actually this kind of ice is not the very best. A larger block is actually better, such as a small styrofoam cup with ice all the way to the top. Fill the water all the way to the top, freeze it, and then tear off the bottom part, and the top of it can be used to insulate your hand so that the hand is not frozen while you're doing the ice massage of the back. The ice is simply rubbed on the area, surrounding the area far enough so that the entire area of pain is covered, and surrounding the area perhaps a couple of inches. That can give you the very best relief from a backache during the first 24 hours, if it is an acute strain. Then after the first 24 hours, then at that time you should begin using heat and already start with exercising, a little mobilizing, a little stretching, and a little bit of exercising for you. If you continue to exercise past the time that you feel pain, then it's very likely to cause inflammation of the back, and eventually will make it so that you will have even worse back pain than you started out with in the acute phase. Education in the proper body mechanics should be your determined effort. Get a book on backaches from a library, or a book on good back health from a library, so that you can become acquainted with just how the body functions, just what structures are there in the back, and just how to go about keeping the very best body mechanics. Now, I think that probably ice is the favored treatment for backaches, but there are several different kinds of things that we use for all kinds of skeletal pains. And they spell the word RICE, that is rest, ice, compression, and exercise. Exercise includes also some stretching. Now, for years, physical therapists have been guided by two different kinds of back exercises. The McKenzie exercises. These are the ones that tend to put the back in extension, although there are some flexion exercises as well in the McKenzie method. For years we used the Williams method, which was almost entirely flexion. But if you will take a look at the back, you can see that the disc, if the person bends forward, this opens up the disc space in the back and will allow the disc to travel in that way. With the McKenzie method, to put the back in extension so that the person leans back, this allows the disc to move forward a bit, and the forward moving disc is something that we aim at in the treatment of the back. Now, some exercises that are very helpful are the pelvic tilt, the knee to chest exercise, the double knee to chest exercise, and some standing pelvic tilt exercises. And some of these you might be interested in just seeing some diagrams of how they might work. Here is a back exercise with lying on the back, keeping the back flat against the surface that you're lying on, and then simply pulling the knees up with the arms and pulling the head up off lifting the head up off the floor or off the back. Then here is a low back stretch. Notice that it's done from the knees. It is also strengthening to the arms. And this stretch can be done with the head carried far back and the lower part of the back also lifted, so that you get quite a stretch of the back. Then relieve the stretch by assuming this position before repeating the exercise. Here is another one. This is the seat drop. It can be done with almost no special equipment, only a chair. The person sits on the edge of the chair, and then with the feet far from the chair, be certain that the chair will not skid, and then just lift oneself up. It helps to strengthen the upper back and the arms, and is not difficult to do. Of course, this person is doing it deeply. You do it to that extent that you can easily do so. Then here are the bent knee push-ups, very similar to one that we have already shown. The push-up is done from the knees instead of from the toes, and that can be very strengthening for the back. Here is an abdominal exercise that the person can do. It's done by keeping the knees straight, and the head is simply lifted off the floor. And in this way, we can easily exercise the person to the point that they can develop strength in the back and strength in legs and strength also in all of the thigh muscles. Now, you might hear someone say, what could possibly have caused my backache? Is it my habits? Is it my car? Is it my bed? Is it non-moving joints, such as the sacroiliac joint, or the joint between the head and the neck that won't do very much slipping? None of the vertebrae do much slipping back and forth, but some of these things may cross the mind of the person who has a backache. Is it all of these things causing my problem, or is it just my weak muscles? For some people, the kind of diet that they have is implemental in bringing about backaches. A stimulatory diet, because it holds tension on muscles, can be a cause of backache. Emotional tension is a very common cause of backache. But people always wonder, is it my discs causing my problem? Well, there are some studies in the recent medical literature indicating that individuals who have disc problems are probably at least half of what we have considered in the past. Here is something that came out in Science News, July 16, 1994. And the title is Disinformation, not Disc Information, on lower back pain. In the United States, back pain constitutes the leading cause of work-related disability and the second leading cause of visits to the doctor. Indeed, some 80% of the U.S. population eventually experiences low back or lumbar pain, with an estimated 30 million hobbled by the condition at any given time. While non-invasive techniques permit detailed examination of the spine, such imaging may prove not only a waste of money, but also counterproductive to diagnosing the source of pain. One of those non-invasive types of investigation is the MRI. The MRI uses a magnetic field to induce some transitory changes in the alignment of hydrogen nuclei. A group of 98 people were investigated, and of these, one study showed that they had while they were currently suffering no pain, nor did they have a history of any serious lumbar pain, disc abnormalities showed up in the MRI in 36% of cases. Now, more than half had a bulge in at least one disc. 27% possessed at least one herniation of a disc. That means it had actually slipped. That's a disc that splays out from beneath the vertebrae and presses on nerves. This is called an extrusion. The disc may have even extruded into a cylindrical blob, and yet none of these people had backache. It suggests that whatever pain develops incidental to disc problems may not always be the cause of the person's backache. Here's another study which was reported in Associated Press in 1994. It says that in one study, it found that a quarter of people with no history of back trouble whatsoever have ruptured discs when examined with magnetic resonance imaging, or the MRI. MRIs so widely available, many doctors now routinely order them as a first step when they see patients with back problems. If they find a bad-looking disc, what is commonly called a ruptured or herniated disc or a disc prolapse, they may send the patient on for a more invasive test called discography. After that may come surgery on the back. Dr. Richard Deo of the University of Washington noted that telling people with sore backs they have ruptured discs can be harmful because it then makes them have anxiety. That prompts them to miss work, to be inactive, to become tense in their muscles, and all of this can increase the likelihood of having a more serious backache or even leading to surgery. And I hope this small study will help you not to have a backache.